Hello, everyone. The ceremony is going to begin in about 1 minute, so if you will silence your cell phones, we'd appreciate it. Thank you. Good evening, everyone. My name is Eric Johnson. I'm the program director for the UMKC PA program. I'd like to introduce you to the white coat ceremony and give to you the class of 2025. All right, you may be seated. Welcome, everyone, to our 10th annual White Coat Ceremony. It's a nice time to gather to celebrate this milestone for these excellent students. We begin our celebration by acknowledging some honored guests. Welcome to the Dean of the School of Medicine, Dr. Dean Norbash. And to the Assistant Dean of Health Professions, Dr. Julie Banderas. On behalf of the faculty and students, we would like to express our gratitude for your work and your leadership and your support of our program and our students. The program would not enjoy its success without an outstanding faculty and staff. This morning, we have all of the program's faculty in attendance, save one. We'll miss Sarah today. They are Director of Clinical Simulation, Stephanie Painter, Erin Aubrey, Director of Clinical Education, Kirsten Stevens, Director of Outreach and Research, David Walker, Director of Written Assessment. Mr. Walker deserves special thank you for his organization and efforts in planning this celebration today. Dr. Ed Kramer is a faculty member and the program's medical director. All the faculty work very hard and are dedicated and devoted to our students, and their work for the program is remarkable. Thank you very much. Amber Blair and Basma Alzidi provide administration for student support to the department's programs, including the PA program. Dr. Laura Bagley leads this team and deserves special recognition for her significant administration work, talent, and leadership. Thank you very much. For over a century, the white coat has become a symbol for the physician, but more recently it has broadened it to represent all clinicians. Additionally, the white coat serves as an homage to the sciences. We would like to recognize the scientists and science educators who have played such an essential role in society and for our students. Likewise, we understand that the humanities and many non-science disciplines have come to form these students. To them, we also extend our thanks. There are iconic figures in medicine. One of them is Dr. William Osler. He is quoted as having said, "He who studies medicine without books sails an uncharted sea, but he who studies medicine without patience does not go to sea at all." The PA program partners with many clinical institutions and preceptors. These preceptors are the gateway to patients and the captains of our students' education during the clinical year. They are instrumental to the program and the profession. We could not be more grateful to them and for their contribution. If you serve as a clinical preceptor, please raise your hand. The program sincerely thanks you for your efforts and expertise. Thank you very much. Thank you, honored guests, faculty, and everyone joining us for this transformative ceremony. I would like to invite Dean Norbash to provide his remarks.
Good afternoon, everyone. It is an honor to be here and to participate in this ceremony. I would like to share some thoughts about the White Coat ceremony, if I may. First, let me thank our teachers for your commitment and for your generosity. Let me also thank our students' loved ones for your love and support, which is vital, essential, and totally valued. I'd like to talk a little bit about the history of the White Coat. If you were to see a group of caregivers in the 1850s, they would be dressed in black, and they would look very somber. There was a sorrowful formality about healthcare at that point in time, because there was very little that could be done. And so oftentimes visiting a healthcare delivery person was a last resort and a precursor to a worsening condition and potentially death. Also, there was a practicality to wearing dark clothing because it would hide stains, such as blood and bodily fluids. And surgeons went from patient to patient, for example, without being mindful of the need for sterility or cleanliness. In 1875, a famous illustration by Thomas Eakins, one of the greatest artists that the United States has ever had, was called The Gross Clinic, and it embodies this. It was drawn for the 1876 Philadelphia Centennial Exhibition. That was the centennial of the United States. It was not shown because it looked too grim. By several years later, and about 20 years later, the Agnew Clinic was an illustration also by Thomas Eakins, and it was drawn on the occasion of the retirement of Dr. Hayes Agnew from the University of Pennsylvania. However, in this instance, the healthcare delivery individuals were all dressed in white, and they appeared to be luminous in the illustration, like there's a heavenly light shining on them. Same artist, 25 years later. What had happened in that period of time? Well, as an example, William Osler studied malaria during the construction of the Panama Canal and described the need for cleanliness and how cleanliness helped prevent disease. So this realization that cleanliness prevented disease was one of the reasons why white became important, because now it showed those stains that were no longer hidden, and it reminded us of the need for cleanliness. 1910, Abraham Flexner wrote the Flexner Report, which established scientific method as the appropriate foundation for medical practice. So now the primacy of science became apparent to us and important for us to understand that care delivery isn't a matter of our opinions or our sentiments. It's a matter of what science and discovery demonstrate to us. And so when science shows that infection is a bad thing and can be transmitted, and then all of a sudden we pay attention to it, we do something about it, and we start wearing white. By 1915, the majority of surgeons were wearing white coats. By 1948, at the end of World War II, Effectively, physicians, trainees, medical students, nurses, all were wearing white. This was a new thing. Now, are there disadvantages to wearing a white coat? Thomas Pickering of Cornell described white coat hypertension in 1988, that recently. In 1988, he realized that about a fifth of patients who have diastolic hypertension with measurements of 90 to 104 millimeters have white coat anxiety. If they're to take their blood pressure in a home situation, the blood pressure is fine. If they're in a healthcare delivery center with people wearing white coats and white smocks and looking professional, the blood pressure goes up. And white coat anxiety is the reason why many pediatricians and psychiatrists avoid wearing white coats. So when was the first white coat ceremony? So that was 1988 when that publication came out. 1989, a year later, was the occasion of the first white coat ceremony. It was at the University of Chicago. Dean Norma Wagner. It was initiated by 2 observations and some complaints from some of her faculty that at times students were showing up with inappropriate clothing for patient care. So the question became, well, what should they be wearing in order to look more professional, if you will? So that was one reason that the white coat ceremony started. The other reason the white coat ceremony started was, up until that time, the Hippocratic Oath was stated at the end of training. After you spent your time training, then you took the Hippocratic Oath. Well, that's not particularly useful. If you take the Hippocratic Oath at the beginning of training, it reminds you about what's important and what your role is, and you're mindful of that while you're training. So it was decided to move up this important occasion, the recitation of the Hippocratic Oath, to the beginning of training. So speaking of disadvantages of the white coat, the only disadvantage is not necessarily hypertension in some people. The other disadvantage is a hygiene-related consideration, and it's part of the reason for a request that I have of you. 100,000 Americans every year die as a result of poor hygiene in healthcare settings. So you will hear continuously about hand washing initiatives that the hospitals and clinics you go to are going to have. The reason it's a perpetual initiative, it's poorly followed. If we followed the need to wash our hands on a regular basis between patients, we would decrease the number of fatalities by 6 figures, potentially. And part of the culprits are the sleeves, because the sleeves drag on people, and you can convey from one person to another an infection. Now, in Northern Europe, in Denmark, and in the United Kingdom, the lab coats are short-sleeved, and underneath them your sleeves are also short, so your forearms are bare. And that allows a little bit more cleanliness. But that hasn't caught on here, and even in Norway and Finland it hasn't caught on. So as you hear more about that with the passage of time, that's the reason for it. The reason I tell you about it today is please remember to wash your lab coats on a weekly basis. It's something that we forget to do. Let's please consider now the Hippocratic Oath, which has at least 4 themes. One theme is to demonstrate respect for my teachers, which is a little self-serving by people like me to say something like that. The second theme is the professional commitment to help my patients. I will do my best to cure the ill at all times. A third theme is a life commitment. I will abstain from all wrongdoing and harm. And finally, a fourth major theme is that I will respect confidence of patients, or information that they give me, as a holy secret. And that's how it's verbalized, as a holy secret. So when we talk about the need to be mindful of what we're saying in a healthcare settings with other individuals, this is something that is really critical and important to us as healthcare delivery individuals. So we're given a unique privilege in society. We're allowed to heal our fellow humans who are in pain and discomfort and openly or secretly frightened of what we may discover as we try to help them. We're allowed to have access to their most personal selves and private selves. We are allowed to touch them with their permission. They place their trust and faith in us and believe that we have their best interests in mind at all times. So I have 2 requests for you. The first might seem somewhat petty or mundane for discussion in this setting. The second is philosophical and may seem a little bit sanctimonious. Let me make the mundane request. Please remember to wash your hands between patients. And remember that the white coat reminds us of the need for cleanliness. Remember to wash your white coats on a weekly basis. And as simple as they seem to be almost impossible to put into practice. That's why I mention it with this one occasion. And now for the philosophical facet of this conversation. Once you put on that white coat, it never really comes off again. It's part of who you are. Your being here in this day and for this occasion shows your commitment and serious intent to practice in this area. This means that many in society will trust you profoundly and virtually to a greater degree than almost any other people. They will look up to you, will follow your lead, will emulate you in action and deed, because you promised them your best efforts in securing their health, their comfort, and their life. We are always ambassadors. I remember one instance when I was on a shuttle at a ski meeting, and I saw two individuals who were healthcare delivery people sitting in front of me. The shuttle held maybe 20 or 30 people. These two individuals were talking about information that had nothing to do with healthcare, but I identified them as healthcare delivery individuals, and every other word seemed to be a vulgarity. And I sat there recognizing that for all they know, somebody could recognize them as a healthcare delivery person. So when we talk about those professional expectations, we are ambassadors at all times. We have to be professional at all times. The coat never really comes off. So please remember this at all times, that our work is the result of a sacred trust, that we must behave with honor and dignity at all times. We must do our very best at all times. We must be the essence of kindness and compassion at all times. And this is the oath we make with society as we gather here to seal our pledge. Thank you.
This time I'd like to introduce the clinical director, Erin Aubrey. She will make some introductions for us.
Thank you all for being here. The growth of PA students during the clinical year is truly remarkable. While they learn a great deal about medicine, they also grow personally and professionally. This would not be possible without outstanding preceptors. At this time, I would like to recognize the UMKC PA Program Preceptor of the Year, Dr. Chelsea Fair. Dr. Fair practices full-scope family medicine with College Park Family Care. In addition to her family medicine residency, Dr. Fair completed an obstetrics fellowship. With this advanced training, Dr. Fair has generously precepted 12 UMKC PA students for women's health rotations since January of 2023. Dr. Fair consistently receives glowing feedback from the students. As I prepared for today, I looked back on student comments. Words I saw repeatedly included professional, kind, caring, and supportive. Soon-to-be graduate Daphne Lynn nominated Dr. Fair for this award. Daphne shared the following words. During my time with Dr. Fair, she was exceptionally welcoming and showed genuine care and compassion to her staff and patients. She made a point to ensure I was involved in every possible procedure, including deliveries. Dr. Fair consistently gave constructive feedback, encouraged me, and provided helpful teaching. She and her staff made this my favorite rotation. For both our students and her patients' best interests, I hope that Dr. Fair continues to work in the Kansas City Metro for years to come and receives the recognition for her exemplary work as she deserves. Another student, Marcus Andrews, summed it up perfectly. He remarked that Dr. Fair and her team are phenomenal. He said that any student would be very lucky to learn from her and her staff. Dr. Fair, we are so very lucky to have you as a preceptor for the UMKC PA program. We are grateful for your dedication and generous contributions to our program. Dr. Fair, if you'll step forward, faculty Kirsten Stevens will present you with a certificate and a gift. And Daphne, we'd love for you to join us for a photo as well. Okay.
Thank you, Erin, for the presentation, and thanks again, Dr. Fair, for everything that you're doing for the program. I, too, would like to talk about the white coat ceremony and a history about the white coat. And you're going to hear some similar things that Dean Norbash mentioned. I have a little bit of a different perspective on some of the things. So. You may be surprised, but maybe not so much anymore, that originally the white coat did not cloak the physician in white, but in black. That may sound strange, but it makes more sense when you realize that black has and continues to be the color of formal attire. Interactions with patients were formal affairs, and you should dress for the occasion. The transition from black to white is illustrated in two works of art by the American painter Thomas Aiken. You can recognize this description of the Gross Clinic circa 1875, which depicts the operating theater where a young patient is undergoing surgery on his leg. The operating theater is an accurate term, as the painting depicts stadium seating with some in the audience peering over one another to view the skilled hands of the surgeon, while others seem to be taking notes. The surgeon, Dr. Gross, the medical assistants, and the audience are dressed as if they are taking in a performance. Indeed, the operating theater is still occasionally used for the more common operating room. Missing in Aiken's The Gross Clinic is protective clothing of any color. There are no surgical masks or gloves. And if we juxtapose that scene with Aiken's other work, The Agnew Clinic, circa 1889, a mere 14 years later, we see more familiar elements. In that painting, the audience members remain in stadium seating and are dressed for a performance, but the surgeon, Dr. Agnew, the medical assistants, and the patient are all draped in white. Still, there are no gloves or masks. What happened in the interim? Clearly, our clinicians had fully embraced the work of Koch's germ theory, but they did understand that cleanliness was necessary for the care and healing of patients. It seems that black could no longer serve to conceal the stains of hard work, sweat, and blood. The truth and transparency of white would have to take its place. It would take its place in medicine and nursing, where the nun's black habit would yield to the white for those religious orders that cared for the sick and dying. Consider St. Teresa of Calcutta and the habit of the missionaries of charity, and at one time of every nursing school. In English, the word candor has its etymology from the Latin candidus, meaning white. Applicants to PA schools are termed candidates, and individuals seeking entry into the profession, and the foundation for all the profession is truth. We move from the white coat to the white coat ceremony because Dr. Arnold P. Gold envisioned a cloaking ceremony that would symbolize the transition from a non-professional to a clinician to be as they begin their studies in medicine. Some medical and PA schools hold this ceremony when they first matriculate as they begin their studies. For the UMKC PA program, this ceremony represents a formal end to the concentrated hours upon hours upon hours upon hours of studying during the didactic phase of the education. And far more significantly, it symbolizes the transition where the chief teacher moves from the professor to the patient. The center of all the students' attention now transitions and is placed before and entrusted to these patients. They will no longer be talking about the patient, but will begin talking with them. What a gift you have been given to serve them and care for them. You have never been more needed as you move forward. Your interactions with these patients will provide you with the highest elations and the most excruciating heartbreaks. Even today and now, I see them in my mind, hundreds of patients and their families. Most of their names elude me. Some of their faces elude me, but most of them do not. They will shape and mold you over the phase of your formal education and will continue to do so throughout your career. With your dedication and devotion to them, you may change their lives, but far more, they will change yours. Congratulations. You've earned this moment and the next step in your education. Please make the most of it. Congratulations, guys. Okay, it's time. Will the faculty please take their place on the stage? Jack Hitzman. Sarah Horton. Sierra King. Samantha Montgomery. Miles Ortiz.
Kylie Bias. Chase Pennywell.
Jessica Kondratenko. Lauren Neubauer. Alia Noor. Joe Bittner. Anna Karendang. Kinsey Schrader. Jackie White. Brooke Wilson. Gloria Quick. Miriam Rice. Marian Abdirahman. Nathan R. Kayla Schaefer. The students were able to reflect on what this ceremony means to them and their progression in the program. We will now share their submissions with a short video. At this time, I will now recite the Hippocratic Oath with the candidates of the class of 2025. Will the candidates please stand? I swear to fulfill to the best of my ability and judgment, this covenant. I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow. I will apply for the benefit of the sick all measures that are required, avoiding those twin traps of overtreatment and therapeutic nihilism. I will remember that there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say I know not, nor will I fail to call in on my colleagues when the skills of another are needed for a patient's recovery. I will respect the privacy of my patients, for their problems are not disclosed to me, that the world may know. Most especially must I tread with care in matters of life and death. If it is given to me to save a life, all thanks. But it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God. I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility includes these related problems if I am to care adequately for the sick. I will prevent disease whenever I can. For prevention is preferable to cure. I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body, as well as the infirm. If I do not violate this oath, may I enjoy life and art. Respect it while I live. And remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling. And may I long experience the joy of healing those who seek my help. At this time, I'd like to introduce our medical director, Dr. Ed Kramer.
Thank you, Mr. Walker. Class of 2025, this is your big night. Don't they look great in their white coats, everybody? The white coat ceremony. So really, why all the fuss? Why is this so important to each one of us? Sure, the coat helps you look like a professional, makes you look like $1 million. Clean, pressed, but don't forget, always, you were thinking this, pop the collar. I don't mean to be sarcastic, not trying to be cynical. This rite of passage does mark a major transition from preclinical training to clinical, from classroom to exam room, from PBAs to seeing real patients every day. From the comfort of your PA program home to clinics and hospitals, perhaps outside your comfort zone. The white coat holds everything you will need for your clinical rotation, so you can relax, okay? It holds your stethoscope, your cell phone, your electronic medical record, believe it or not. What we used to call the peripheral brain, I used to keep it in this pocket right here, but now it's here. Peripheral brain, and much more. But there must be loftier significance to this garment at its core. Students, you just shared in a video what your white coat means to you. I'd like to add some considerations from my personal point of view. Compassion, responsibility, professionalism, respect and dignity, treating all patients according to their needs, incorporating the arts and the humanities. Just moments ago, you took a Hippocratic oath dedicating your life to the service of humanity, prioritizing your patients' well-being without bias or vanity, treating your teachers and colleagues with the gratitude and respect that you yourself have rightfully come to expect. You know, PA training has always been a journey. This day marks a major milestone toward your destination, arguably the greatest step, undeniably a cause for celebration. Yes, your patience and hard work are paying off. Challenges ahead will be many, that's fair, but the rewards will be so much greater as you participate directly in patient care. Keep in mind that being a PA student is a privilege to be earned continuously by those chosen to enter. And as faculty, we too must earn the privilege to serve as your teachers and mentors. So many pearls of wisdom to share. But for last, I've saved the best ones. As Dr. William Osler said, listen to your patients. They are telling you the diagnosis. To which I would add, of course, ask more open-ended questions. Class of 2025, enjoy your celebration with family, friends, and faculty. Congratulations. And now for closing remarks, it's my privilege to introduce Dr. Julie Banderas, Associate Dean, Professor and Chair, the Department of Graduate Health Professions in Medicine.
Thank you, Dr. Kramer. For my closing remarks, let me tell you what the white coat ceremony means. Just kidding. So, I do want to share with you that this is a milestone for the PA program. This is our 10th UMKC PA program white coat ceremony. So we're excited about that. Ready? I want to thank Dean Norbash and welcome him. This is his first white coat ceremony, and we look forward to many more. Thank you for joining us and for your inspiring words. To Chelsea Fair, Dr. Chelsea Fair, thank you again for your professional stewardship and sharing your amazing treasures of knowledge, expertise, your patience, as in people patience and time with our students. To Mr. David Walker, you deserve special recognition as the commander of this special event. We appreciate you. Candidates, you will not be surprised that my closing remarks, as usual, will now turn into last-minute instructions and things for you to do. So, before we can adjourn for the celebration, will you please stand and turn towards the audience? We are very proud of you, and we congratulate you in achieving this milestone. Now, please remain standing and looking towards the audience. I ask you to recognize all of those who are here and also on the live stream who love and support you and who have played such an important role in your achievements. So thank you to all that support these students. Last, before we can go, I need to invite the guests to get some refreshments while the candidates must go directly, in capital letters, go directly without stopping to the bottom of the stairs, the students and faculty for the group picture, and then you may quickly return back to celebrate with your family. That is the end of our program. Thank you for joining us.